afternoon. I am Dr. Alleyne, and I'm sitting here with Ms. Linda Keys from South Texas Health System Children's. She has been a social worker for the past 37 years, 36, 37 years. And we're going to sit and discuss the role of a social worker and some other questions. Linda, thank you for being with us. Can you tell us what is the role of a social worker in the hospital setting?
We have to be advocates, first of all, and we have to be available to the whole medical team. As far as, you know, what the patient's going to need, we have to help them to have a safe discharge before they leave the hospital. We have to make sure that they're going to have their medications. That's just one part of it. The other is all the stressors that are involved with being a patient in the hospital, especially with parents that are going through so much.
Thank you, Linda. And how is your role different from a case manager or case management?
RN case managers, there's two of them that I'm aligned with. As far as RN case managers' role, they have to ensure that the patient is in the hospital in an appropriate stay, whether it's inpatient or observation, that they're also getting the appropriate care in the appropriate bed. We work as a team, and if there's any complications with the insurance, we communicate with the insurance to make sure that we're going to be getting some kind of coverage for their care here at the hospital. Even those patients that don't have insurance, we're looking at every single patient that comes in the door to make sure that they are going to have an appropriate stay and that their days are going to go smooth. And also, if there's any quality issues going on or any risk factors going on, we have to address those issues.
What do you mean by risk factors?
If the patient is at risk, and we notice that there's a risk situation, we have to report it to the risk management team. If the patient is not getting the care that they need, then we have to address it at a higher level. If a patient needs to go to a higher level and we're not able to meet those needs, we're communicating with the doctors. And we're trying to make sure that that risk situation does not get out of control.
And you were referring to risk of medical malpractice or medical care or social situations at home?
All of it.
All of it.
All of it.
And when should a patient or a physician request your services? What are some clear areas that we should request a social worker?
That's a good question. I believe that every patient that is in the pediatric ICU should be seen, simply because it's a high risk, how long they're going to stay there. Families are going through so much just being in the hospital. But to get a referral, I have an open referral policy. Anybody can give me a referral. Families can request for a social worker. The nurses, if they see something, they can request a social worker, even the therapist. But as far as doctors, if you need a specific consultation, mental health like suicide attempt, drug abuse, if a child has ingested medications, if there's family issues, if there's a patient that is got a chronic illness and there's a lot of issues going on with the family accepting the diagnosis, that's where we come in.
Thank you, Linda. What avenues do patients and family members have when they feel disgruntled about their care?
Well, there is patients' rights and responsibilities. Patients have a right to receive medical care, and if they feel like they're not receiving the care that they expect, then there could be a communication problem, a language barrier, or cultural or religion. There's so many factors involved that maybe they misunderstood something. So they have a right to request a social worker to come in and talk to them about the issues. If it's just a simple communication issue, then that can be resolved. If there's more factors involved, then sometimes I do have to call a patient advocate, patient representative to come in, try to solve those issues.
And I'm so glad that you said that, because that leads into my next question. How is the role of a patient advocate different from your role?
That's from an administration role where they will take it to the higher level. And sorry, I can't answer totally on that, what they do exactly. I just know that I'm an advocate also, but if I get to the point where I can't help them anymore, and it's more of an administrative, for instance, if it's a service we can't provide here, then in an administrative level, they can try to help the patient get what they need. They'll communicate with the doctor if they need to go to another facility. Like if there's a procedure that we can't do, then they can intervene and try to find a way to get that procedure done.
And can anybody ask for a patient advocate? Just like how anybody can ask for a social worker?
Yes.
Okay. And are there any avenues that you know of in your 37 years for patients or families to influence their hospital administration?
What was that again?
Are there any avenues that patients or families can provide their input or influence the hospital?
They have a right to communicate with administration, to go to their office, to voice their concerns. They do have that right.
So they can just say, where is administration, and go?
Yes.
Okay. Or they can ask for the administrator on call?
Yes.
Okay.
The house supervisor on the weekends and at night.
Okay. And let's segue into a different topic. Do you have any recommendations for when families or patients cannot afford their medication or their medical equipment?
Okay, for medications, depending on the medications, like for diabetes, I'm working with one right now. There is some coupons for certain medications, like Novolog or Levemir. Usually the pens are more expensive, so we try to get the vials and of course the syringes. There are some websites like pharmaceutical charity programs that people can apply for. If that's not an option, then we have the clinics that are here in the Valley. One of them is Nuestra Clínica del Valle. There's also the Hope Clinic. We usually ensure that the patient has their medications before they leave the hospital. And then we also give them the referrals to the different clinics and pharmaceuticals, charity programs. We also give them the Good RX and other coupons that they can get before they leave.
Linda, what is Good RX?
It's like a discount for the medication.
And that is online? You just Google Good RX?
You can. I usually give them a card.
Okay. And finally, do you have any tips for parents or caregivers or even patients themselves who are adults on understanding their insurance policy?
That's a good question. My parents are Medicare, and Medicare and Medicaid and all these insurances, especially Medicare, they have evolved into managed care. And that means that the market was open to all these insurance companies to manage the insurances and give, every insurance company has certain plans. Some are better and some are not so good. It's really important to research the insurance, talk to the representative to find out everything you can about the insurance. You can also look online if you have access to a computer to review the insurances. There's all kinds of insurances out there that promise all these services and they may not cover. And every year it changes.
So your insurance coverage changes every year, but what are some things in particular you should look at?
Make sure that, like on Medicare, that, of course, that it has Medicare Part A and B, and then there's, that it also has the coverage for medications, because there's a lot of people that don't know about that they have to get the medication coverage. Also the supplement at the hospital, I believe it's now up in the thousands of dollars to cover for the deductible, and some people don't understand that. Medicare Part A covers 80%, and then you 20%. And so the deductible is what some families are struggling with, and they don't realize that they can get a supplement either through the managed care or through another insurance. But then there's a cost to that.
So you buy a supplemental policy on top of the Medicare or Medicaid policy that you have?
Yes, not unless that managed care offers to help with that deductible. Of course, Medicaid also has a program where they can cover the deductible if you qualify for that. Excuse me. On Medicaid, there is some programs that under Medicaid that covers the deductible for Medicare, and you have to apply for that. There is also what they call the Medicaid buy-in program, and that's through the state. Each state has their own different programs. The state of Texas has their own, the state of California, every state is different.
Tell me more about the Medicaid buy-in program.
It's there. I mean, I don't know all the details, but I can send you some information on the Medicaid buy-in program.
Perfect. Then we'll put that on the link. And you were going to tell us also about what if you can't afford your equipment.
Yeah. On medical equipment, I call different resources. I know there's in San Antonio, Texas, there's a closet, and there's people that donate their equipment after they're no longer using it, or they just want to donate. And it's a closet. I was able to find a bariatric bed for a patient. And the family, all they had to do was call and then go pick it up. If they were struggling on how to go pick it up, I call around the different DME to see who would volunteer to help this family. Other things like if they need a nebulizer, I call different DME companies to see who's willing to donate a nebulizer. Usually if they have some kind of insurance, it should cover, but like glucometers, I try to find like the children here, if the parents aren't able to afford the glucometer, I'll call the Juvenile Diabetes Association, and they may have some glucometers they can help the family with, even with insulin sometimes, depending on the insulin that they have.
Okay. Linda, thank you so much for your time. Before I go, I have one last question for you.
Okay.
Given your 37 years of experience, what advice would you give to first-time visitors to the hospital who are patients or have loved ones within the hospital, whether it's in an acute care setting or an ICU setting?
Ask for a social worker. If they're worried about something, it's better to address it early on, not wait like a few days before discharge, because there are a lot of challenges, and there could be some barriers that it takes time to work those out, so that if they want the best outcome, it's better to address it early.
Okay, thank you so much. And before I let you go, I have one last question. For patients and families who do not feel safe at home, whether it be through domestic violence, child abuse, elder abuse, human trafficking, what can you recommend?
If there's a child.
How can they bring this to their medical team awareness?
Well, for any suspicion of human trafficking, there's a hotline where I do call if there's any suspicion of any kind of human trafficking. If you have any suspicion, it needs to be reported. Child abuse definitely has to be reported to Child Protective Services. There is a hotline in every state to call Child Protective Services. Children are very vulnerable. They cannot defend themselves. They expect the medical team to do something. Even if there's neglect, we have to address it right away before it escalates, or we don't want a child to ever die because we didn't do our part. As far as domestic violence, there is some women, unfortunately, they're in vulnerable situations and they feel like there is no recourse, and so they have to be educated, and they have to be informed about what is available in the community, and that there is a recourse, and sometimes they need a helping hand to get to that safety net. So whenever there's a suspicion of a possible domestic violence or abuse, it has to be reported, and information has to be provided. If it's not safe for them to go home from the hospital, then we find a shelter for them and their family to go to.
Thank you so much for your time, Linda.
You're welcome.